Welcome back. It's Wednesday, which means your Eye on Health with Dr. Sudip Bose, Medical Center Hospital. Doc, thanks so much for coming in today.
Great to be here.
It's summertime, and we're talking about, it's going to be time to go out to the pool, have some of these, have a few of these, but what we really need is this guy right here. Let's talk about that.
It's true. We're talking about dehydration today, and the weather gets nice, we get outside, we sweat more, which means we're losing fluid and we can get dehydrated. Right. So let's quickly chat about this, and then we'll talk about some of the signs and symptoms. So our body is largely made out of water. We need water, and we lose it when we're out in the heat, and this is what we should be drinking. There are other things that are liquid that do not hydrate you as much.
Right.
Things that are filled with a lot of sugar, whether it's soda, and we had a separate segment on soda.
Yeah.
In general, there's really no nutritional value from this. It does not hydrate you as much. And some of these things, like beer, they actually, even though you're drinking, it's net dehydration. So you're losing more. Yeah. Beer has a diuretic effect, and you pee out more than you take in with alcohol, and you get more dehydrated. It's important what you take.
You're at the pool and you're having a lot of these and probably no water while you're out there.
Right. And it also depends. Notice what's not here is a sports drink.
Right, Gatorade or any of those.
Right, because if you're sports drinks have electrolytes, and some of them are sugary as well, but most of us, we get our electrolytes. And how do we get that? We eat something called food, and we put it in our mouth and we get electrolytes. So
the right food.
The right food. And we don't really need sports drinks. If you're heavily exerting and sweating a lot, perhaps it may help. But again, you can probably get that through food, so that's okay. The other thing I mentioned, the one take-home point I'd like you guys to remember about hydration here is take a look at your urine. Your urine should be almost clear, like a very clear yellow. Not completely clear. That's probably you're drinking a bit too much, but it shouldn't look like motor oil or dark.
Right.
And that's a good gauge. Without getting into too much complicated information about electrolytes and balances, just look at the urine, and that's a good guide in general.
How about water pills? Now, we heard something about this. Are you hydrating when you're taking these?
So people with heart failure, for example, may be on something called water pills.
Right.
And the name is misleading because water pills are diuretics. They make you pee more because when you have heart failure, you need to get rid of some of that excess fluid that may be accumulating in your body tissues. So even though you're, in that case, you're peeing a lot and you're losing a lot of water, and that's the intention. So don't get fooled by that name. The other point I'd make is with the different ages. So if you divide this up into little babies, us, and then elderly.
Right.
Let's think of like a nursing home patient, for example. There are different things to get concerned about. Like babies, if they start losing a lot of fluid from vomiting and diarrhea, they can get dehydrated pretty quickly, and they can't tell us they're thirsty.
Of course.
So you have to look out maybe for the urine color if you can see it, and then Pedialyte is a good way to hydrate children.
Kids.
So Pedialyte out there.
Okay.
For us, we may be exerting the 11 o'clock a.m. to 4 p.m. is the most exertional. The sun is out, we sweat, lose fluids. So just, again, your water is probably the best.
Yeah. And
when you get older, the two extremes of age, very young, very old, they're the most susceptible. So elderly patients, they don't get thirsty as much. And that's another point I'd make. By the time you're thirsty, it's too late. You're already dehydrated.
Right.
So again,
drinking.
We're watching that urine. We're watching the color of the urine. We're not waiting till we're thirsty.
Yeah.
So elderly patients, again, just stay active, get them hydrated, and then the other thing we point to the audience is sometimes you get so dehydrated that they need emergent care, and we see them in the emergency room. So this is when we need to kind of force hydrate them, whether it's putting a needle in their vein and hydrating their veins with an IV. And that's basically if they can't keep the fluids in themselves.
But let's not get there. Let's just keep on drinking these guys right here, and let's put these aside.
Exactly.
Make sure you have these, and if you're drinking out by the pool, have a water in between every drink you have, every beer you have.
Exactly, and if you're vomiting diarrhea so much that you can't keep it in, you're passing out, maybe then seek some medical care.
All right, Dr. Bose, thanks so much for joining us.
Thanks, Robert.
And if you have any questions at home you want answered here on the front page on Wednesdays, go ahead and submit them to the email you see there at the bottom of your screen. We'll be right back. Stay with us.